I remember being at my house and staring at one of the first responders and looking at him and saying, "Why aren't you doing anything? Why isn't she coming out of the house? Why is this happening? What's going on? Fix her." It was hard for me to perceive in that moment that my sister was gone and how it had actually happened.
It started to build up and build up and build up to the point where I would wake up in the morning, I would think about dying. All day long I would think about dying. I would go to bed praying to God, why don't you just take me? I'm nothing but a loser, a failure.
He was very brilliant, handsome, very difficult to understand why.
My sister at glance was extremely outgoing, pretty popular, had a lot going for her, and that was all what we perceived and knew her as. There were a lot of underlying mental health issues and other things going on that went under the radar and unnoticed by a lot of us.
People used to call me up to come to parties because they'd have a lot of fun when I was there, but when I was alone I didn't feel like I belonged there or anywhere.
He was very quiet. He kept a journal. In his writings, he said he used to dig pits and try to hide in them. To me, that was some indication of how, unhappy he was.
Suicide is something that we've come as a society to recognize as a big issue that can't be ignored. It has to be treated as opposed to not discussed or looked at in some kind of fearful way.
There is a pain that they don't believe will go away, that even if they get better for a short period of time, the depression returns, and it's a struggle that wears people down.
Some people assume that if someone really wanted to die, they would just go die. They wouldn't let anybody else know that that's the way they were feeling. Statistics have shown us that 80% of people who die by suicide have indicated through a warning sign to the people around them.
You hear the typical things that people are giving away their possessions, they're kind of saying their goodbyes, they're finalizing things. But there's cases where there was no note, there was no indication, there was nothing. There are people that have made plans for later that day and they ended up completing suicide.
They could be young, they could be old, they could be Christian, Muslim, Jewish, every ethnic age line.
People who are suicidal, they're not thinking about hurting themselves. They're thinking about ending their pain.
The same situation could happen to 10 individuals, and one will contemplate and attempt suicide, where the 9 other people may be resilient or know what to do and how to deal with the circumstance and have that skill set inside of them that they know it will be okay.
Depression and other mental illnesses can be terminal illnesses, and we need to start recognizing that more and responding to people as if they had a life-threatening illness, because mental illness is life-threatening.
Hope is what's missing for a lot of people. That's why we say one of the serious warning signs is a sense of hopelessness.
Sometimes people will come in and say, I feel like killing myself, but I don't have a plan right now. Then you'll have others who say very specifically, I am going to kill myself, and here's how I'm going to do it.
Sometimes problems are evident in a workplace that wouldn't be evident at home. If you don't have a lot of contact with a family member who may be busy at work all the time, and they're struggling, but maybe their coworkers pick it up, but their family may not.
When I was a teenager, I thought a lot of, geez, I just wish I wouldn't wake up. If I didn't have enough money to pay a bill, the fear would get in there. And that was almost automatic for me, was that would be my first thought. I'll just get out of here, just leave, I'm done.
Sometimes it's just a matter of very subtle warning signs that go undetected, and sometimes it just catches you completely off guard.
He wrote a letter saying that he had constant thoughts of suicide.
Being her older sister, she was 15, I'm 17. We started to argue a lot more. Our relationship kind of deteriorated over a lot of silly things that I thought would pass. Now I could see there's a lot of things that were changing in her and things that she started to do that were out of character that if I looked back now, I would know that those were signs and indications that she was going through something and needed help.
I have 6 children, 6 beautiful children. I walked around a lot of the time feeling that I wasn't really worthy of their love or their care, and couldn't feel it when they tried to get in, It got to the point one night I just was really feeling like I couldn't control it. And I went and I got some duct tape and a hose and Here I am standing in line in the store, and my cell phone rang, and it was my son. And he said, "Hey, Dad, what are you doing?" I didn't say anything. So I walked back and I put the stuff back, and then I went back to the hospital and I talked to the doctor.
People who are suicidal are ambivalent about dying. By that I mean they want to live and they want to die. As human beings, we're not very good with this state of ambivalence. We want it to go somewhere. If we can do something about it while they're in that crisis state of ambivalence, we can save a lot more lives.
My sister had threatened it to one of her closest friends, and then that night she took her own life. She called that friend and said, "I'm thinking about it again." And her friend said to her, "You know, if you do it, I'm going to tell my mom. If you're thinking about it, I'm going to do something." My sister rest assured her that, you know, she hadn't done it 6 months before. She was going to make it through tonight too, and she'd see her tomorrow. That's why it's important to take every single conversation about any kind of indicator as a serious one, whether or not they actually follow through.
You don't have to always understand exactly what they're going through, because you can't. That's a bit of a fallacy. But you have to be open to hearing what's going on.
If you're the least bit hesitant about, gee, I shouldn't let her go home, or I don't know where else to send her, do something. Call the police, call 911.
Everybody should be aware of the risk factors and warning signs for suicide. But if a suicidal patient is encountered, then the appropriate people should be notified so that these people can get the help that they need and the level of care that's required.
Safety is always the first priority. And when it comes to issues of bargains or deals about not hurting yourself, we have to recognize that that clinically isn't supportable. We can't have a contract for safety. We have to get the team involved to intervene with that person and get them back on track towards treatment.
Sometimes the challenge is getting the person to the surface. Some people equate any ideation of suicide with the fact that they potentially could be locked up somewhere, that they might be mentally ill, that the world will call them crazy, that it's probably not the best thing for them to do. A lot of people aren't aware of the fact that some medication side effect could be depression. A possible side effect could be suicide ideation.
Specifically, underlying mental illness should be treated. Sometimes this requires medications. A substance abuse issue needs to be treated, sometimes with residential treatment so that they can be provided a clean and sober environment. And sometimes an inpatient hospitalization is necessary until the patient is stabilized and feeling better. Sometimes it's just at a point in their life that is going to get better with time, such as loss of a job or financial issues. We can help these patients with these social factors as well so that they can feel more confident going on.
Suicide prevention is important, but so is the subsequent treatment, and we have to see this as part of a comprehensive treatment plan.
We would never just treat a patient who is feeling suicidal until they're feeling better and then just send them off on their own. Everybody needs follow-up and support.
Once we identify this, it is all of our responsibility. So it takes all of us to care for individuals who are in need.
Often the resources aren't there when a person's suicidal. That's where the families come into it, that's where coworkers come into it, that's where teachers come into it. We all have a responsibility for suicide prevention. It's not just the professionals. The community really has to be involved in suicide awareness and prevention. And for that to happen, the system has to be responsive and available and accessible.
Individuals that are struggling with mental illness are the priority. Family and friends are, secondary. What happens with family and friends when somebody does in fact complete suicide or there is an attempt? Family, they don't know how to deal with this. They're struggling. Why did this happen? What did we miss? They're angry. Oftentimes when we're talking with family members, they don't want to feel angry, but you can feel it in them. They're struggling, but they're hurting, but they're angry too.
Surviving the death of a loved one to suicide is devastating. People experience not only the grief, but there can be an incredible amount of anger. And then there's guilt about feeling angry towards the person who has taken their own life and left the family to deal with the aftermath.
Guilt is one of the big things that those who you have had someone die by suicide that you have to cope with. I even thought, why didn't I buy him those shoes that he needed? Special shoes, but we had 5 children and I couldn't afford it. But you have to go through that. For me, I needed other people to talk to. My husband didn't even want me to mention my son's name. and I needed to cry and I needed to talk. And finally, Canadian Mental Health formed a group, and that's what saved me.
Over the last 11 years, I've had a number of emotions that's come up. There's times where I feel extremely angry, thinking, why did you choose this for all of us to deal with? But I realized too that she was a 15-year-old young girl who was going through something and who didn't have enough in her to reach out and to find the help she needed.
You will hear stories of spouses talking about that, how could he or she do this to me, leave me with 3 small children, or they didn't see it coming, they didn't know what was going on, why didn't they talk to me? It's not only the grief and the loss, but it's the stigma of it being a suicide death.
If you were to ask other members of my family, for them, they for a long time couldn't even say the word suicide. There were clear indications, though, based on the circumstance and the investigation, that it was a suicide and that that's how she had passed away. I remember waking up and thinking, I'm never going to get through this. This is the most awful thing ever, and it was. A huge thing that brought me peace was knowing that there were other suicide survivors, as we call ourselves, you know, people that have lost someone to suicide. Just knowing in that moment that I wasn't absolutely alone.
In hearing so many stories, I knew that everything I had tried to stop Richard from being depressed, other people had tried, and people who had care way beyond what we as a family or Windsor as a city could provide, and that person still died by suicide. That does happen.
As unemployment rates go up, there's a less amount of jobs in a community. Suicide rates go up, drug and alcohol abuse issues arise. Some people need places to turn to.
And I think immediately of Alive Canada, who can help you understand the feelings that a person who is suicidal has and help you to understand what is going on and how you can reach out and help that person.
Anywhere where there's a need for suicide prevention education, that's what we provide.
You're never going to be able to prevent every suicide death, but one of the goals of Alive Canada is creating a culture of help-seeking behavior.
As cliche as it sounds, things happen for reasons, and I think that my sister passing away and taking her own life has really created an opportunity for people like myself to go into the community and to help educate others and to help young people seek support when they need it.
And I've been able to help people, and at first I didn't want to help people with it because I saw people that were depressed like that. I thought if I started to talk about it, they're going to drag me right back there, that I'm going back to that black hole that I don't want to ever be in again. And the opposite is true. My daughter just had a beautiful wedding, and I was able to be there and walk her down the aisle, and she knows I love her today, and I know she loves me. It's awesome.
As a first responder, I would direct somebody to the Community Crisis Center. It's 24 hours. They will have services available. They're the experts. They know what's out there.
There is hope. There are compassionate people who are working hard to support people in staying alive and in dealing with severe mental health issues. We want people to come out and utilize these resources. I think of us as being the triage when it comes to mental health in our particular hospital. We're the people who are collecting a lot of the information. We have the luxury of time. We get to spend an hour or an hour and a half with one person. Doctors and nurses don't have that luxury. And then from me, they see the emergency room doctor who ultimately makes the decision. Do we need to have this person see a psychiatrist in our emergency room? Are they safe to go home with the supports that we've put in place? So they're making that decision based on the information that we're sharing with them.
Cmha has a range of services from education and prevention to direct support and recovery to supporting caregivers, family members, the general public. So we really have a range.
The Distress Center is a place where anyone can call whenever they're going through any kind of problem. And we're open 365 days a year to talk to anyone who reaches out for help. The beauty of this particular service is that it is over the phone.
It's very confidential and discreet.
The purpose of our COAST team, it's a partnership between Windsor Police and Hotel Dieu, and we go into the community and do assessments on individuals who have a diagnosis of a mental illness or are at risk for entering the criminal justice system. Do they have a history of suicide? Do they have a means? And do they have a plan?
A couple of years after Richard died, I held my first grandson in my arms, and I realized people die, but life goes on. And that little bit was the beginning of me feeling better.